Just 24% of South Africans have had 2 doses of a COVID jab. Vulnerability enough without a new variant at large. Here in Johannesburg and its surrounding province, cases have quadrupled in the last 9 days. And while it's not certain, a new variant may be the cause.
It's hard to see them as locked down again because so many families, depend on the different sectors that are open right now.
I think it scares a lot of people a lot.
We used to be scared when this thing started, but now it's something that we're living with. We can't be scared anymore.
Daily cases in South Africa are nearly 70 times lower than in the UK, but the sudden spike linked to a new strain so very different to anything they'd seen before has put South African scientists on high alert.
The first cases were identified not even 10 days ago. But that means identification. Of course, it could be that this variant was circulating for longer, and then only those were the first cases identified. So now, actually, what is happening, we are going back to samples that were collected earlier in November and even in late October, and we will see if people infected at that stage, they were already infected with the new variant.
The WHO has now named the strain with the Greek letter Omicron. Is it more infectious? Will it evade our vaccines? Researchers in South Africa and around the world are now racing to find out. The variant has more mutations than any strain seen so far, 35 alone in the crucial spike protein, and a concentration of them in the receptor binding domain, the bit of spike that binds to our cells. The Delta variant, which now dominates the globe, has 2 mutations there. The vaccine-dodging Beta or South Africa strain had 3. The Omicron variant has 10 binding domain mutations. Now South Africa's vigilance has been rewarded with travel bans.
The reaction of some of countries in terms of imposing travel bans and such measures are completely against the norms and standards as guided by the World Health Organization.
You can understand their frustration, but the last thing the Northern Hemisphere wants to see as it heads into winter is a dangerous new variant.
I think what we all think at the moment is the sensible thing at this stage is to be precautionary, and then for us, if things look as if they're less bad than currently they might be, then we can ease back. But it makes sense to take precautions early on, and in particular take precautions to slow down the arrival of this in the UK.
Today, the WHO was highly critical of travel bans imposed by the UK and others on South Africa. Just 7% of people on the African continent are fully vaccinated against COVID. Here in the UK, many of us are receiving a 3rd dose. Slamming the door on unvaccinated parts of the world won't keep new variants out, nor will it stop them emerging. Only helping to immunise them will do that. Tom Clarke, Sky News.